Hi there, you're welcome to DEMIRxCARE channel where we talk about medications and how to use them properly. If this is your first time on our channel, be sure to hit that like and subscribe button down below in order to support our community here at DEMIRxCARE. So let's go ahead and talk about our medication of choice today. So our medication of choice today is known as Alendronate. So Alendronate is also known as Fosamax, which is the brand name, or Binosto, which is the effervescent tablet portion of this medication. So what is Alendronate used for? Alendronate is used for Crohn's disease. It's also used for osteoporosis as well as postmenopausal osteoporosis. It is used in patients who have a high calcium level. It is also used in Paget's disease as well as cystic fibrosis. So what doses of this medication do patients normally take? So this medication is available as a 5 milligram tablet taken orally once a day, or patients may take 35 milligram tablet once a week. I've also seen some patients take 70 milligram tablet once a week. So depending on what the treatment is, the dosing may vary in our patients. So this medication is available in tablet, the effervescent tablet, and just the regular tablet, as well as solution. So what are the adverse effect or side effects that are attached to this medication? So this medication can cause abdominal pain, it can cause constipation, diarrhea, gas, indigestion, as well as headache and fever in our patients. So what are serious adverse effects to look out for while taking this medication that you definitely want to be making a call to your doctor or your regular physician regarding those serious adverse effects? So the serious adverse effects I'm talking about include heart failure, or if you start noticing an ulcer, bone pain, a muscle pain or joint pain, or if you start noticing a throat swelling or like a throat condition happening. Also in our patients, when they check their calcium level, if the calcium level is low, they might have to take the patient off this medication for a minute until their calcium level is back to normal. Also in patients who have pain swallowing, or patients who have a painful swelling in their mouth, jaw, or like a loose tooth, these are serious side effects that you definitely want to be calling or reaching out to your doctor regarding when you start feeling these serious adverse effects. So what are the tips regarding using this medication safely and effectively in our patients? So this medication is usually a medication that you want to take first thing in the morning upon rising. So this medication you want to take one of the tablet, after you wake up, making sure that you're not going back to sleep. So first thing after you wake up, you want to take this medication and remain upright for at least 30 minutes after taking this medication in order to avoid any throat irritation after taking this medication. Also, you want to take this medication at least 30 minutes before any food or first beverage or meal of the day or your other oral medication. So this medication should only be used by itself 30 minutes before you consume or drink any other beverage other than water. So with this medication, you want to take the tablet with about 6 to 8 ounces of water, of plain water, while you're on this medication. And in terms of the oral solution, if you are on the oral solution, then you want to take this medication orally with about 2 ounces of plain water after taking that oral solution. So after you drink the oral solution, you can follow it with at least 2 ounces of plain water in order to help the medication settle in your stomach. So like I said earlier, this medication, immediately after you're done taking this medication, you should not lay down for about another 30 minutes until after 30 minutes, then you can lay down, or until your first meal of the day, which is 30 minutes after that medication. then you can lay down. So like I said, this medication should be taken alone, upon rising up from sleeping. Take the medication, remain upright for about 30 minutes, and then you can, do other activity, or, go back to sleep or eat your first meal of the day. Then you're good. So that 30 minutes rule, you have to make sure that you remember that. Also, for patients who are taking this medication as a once-a-week dosing, if you do forget to take this medication maybe during one of the week, let's say you take this medication every Tuesday of the week, and you remember on Wednesday morning or Tuesday night that you forgot to take it at the same time, you can take it the following morning, which is Wednesday morning. Make sure you don't double the dose. You just take that one tablet that you normally take and just continue and keep it moving. All right, so for the effervescent tablet, you don't want to suck on this tablet or swallow or chew the tablet. So you want to put this tablet in about a 4 ounce of room temperature plain water only. So you put the effervescent tablet in that plain water and you let it dissolve, and make sure you're not using any mineral water, flavored water. Wait at least about 5 minutes after that effervescent sizzling stops, and then stir it for about 10 seconds, and then you can take it. So I said, also in terms of the effervescent tablet, it contains about 603 milligrams of sodium. So in our patients who are on a sodium restricted diet, this might not be a favorable form of the tablet. So you might want to stick to the regular tablet that doesn't contain that much sodium. So altogether, it contains about 1,532 milligrams of the sodium chloride. So this might not be a favorable form of the medication, as I said earlier. So you might want to stick to the oral solution or the regular oral tablet because of that sodium content if you are on a sodium restricted diet. Also, in patients who are getting a dental work done, make sure that you're letting your dentist know that you're taking this medication because of that serious side effect of that's known as osteonecrosis of the jaw. So it's just kind of like a tissue decay that happens in the mouth when patient gets like a dental work done while they're on this medication. So it's actually a very serious side effect, and if patients are getting a dental work done, they might have to stop the medication for a while before they're cleared to get that dental work done in order to avoid that osteonecrosis of the jaw. It's usually pretty bad. So those are a few pointers that I have regarding this medication. I hope this helps in terms of what to look out for and how to properly take this medication effectively and safely. If you have any questions, make sure you check out our website, which is www.DEMIRxCARE.com, in order to consult with a pharmacist there, or you can leave a comment below and we'll try to get to the question as soon as we can. If you haven't yet done so, make sure you hit the subscribe button and the like button down below. That way you can help support our community here at DEMIRxCARE. Thank you for watching and stay blessed.